Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, the R rate, showing how rapidly COVID infections are transmitted, has risen again in England. It's now between 1.2 and 1.4, with COVID cases rising at their fastest rate since the second wave this winter. Public Health England says around 90% of them are down to the highly transmissible Delta variant, while people who haven't been vaccinated are the most at risk. While across the UK, there were more than 8,000 new daily cases. One report suggests that government advisers believe that the chance of England's lockdown lifting on June the 24th is now close to nil. Simeon Brown reports.
This still remains a picture of hope, but across a deep pandemic, the variants change. The dilemma does not. Today, new data on the Delta variant further threatens the so-called unlocking, as the variant appears more contagious than the Alpha that led numbers to rocket in late 2020. There are currently over 42,000 COVID-19 cases in England. The Delta variant carries a 60% increased risk of transmission within households compared to the Alpha variant. 90% of those, some 33,000 people, are carrying the Delta variant. Of those, 42 people have died. 23 were unvaccinated. 7 had received only 1 dose, and 12 had received 2 doses.
The numbers are doubling in less than a week at the moment. And so if you carry on thinking about that doubling of numbers that may be going on over the next few weeks, we're going to very rapidly get to very high numbers. And inevitably, that will lead to a lot more hospital admissions.
Here in East London, there's an urgency for the vaccine as COVID looms over our summer. As this new data shows that the overwhelming majority of new COVID cases are of this Delta variant, there is an underlying warning. Although the number of people being vaccinated in centres like this one has been encouraging, there are still people being hospitalised, and the majority of which have not been vaccinated. It's therefore no surprise that the UK Health Security Agency has stepped up its plea to the public to please get vaccinated. However, there are questions over another key pillar of our COVID attack plan. The US-based Innova Medical Group supplies centres like this with lateral flow tests. Now, the American Food and Drug Administration has written a damning warning stating the devices are false or misleading and recommend that they destroy the tests by placing them in the trash. These are the lateral flow tests we have all become familiar with using, that is facing severe scrutiny. Innova, the company behind them, told Channel 4 News that the FDA had not fully evaluated the data. The Department of Health, who have bet big on these tests, say they have confidence in lateral flow tests, and their Innova test has gone through a rigorous assessment here, but this will not stop the questions.
It's particularly concerning because not only are we using these tests, sort of surge testing, and mass testing, we're also using them to replace isolation in certain settings. For example, in schools, there are trials ongoing right now that are replacing isolation of contacts with serial testing with these particular tests, which have been shown to be not highly accurate, and having them in classrooms could potentially put children at risk.
Testing is a front line against COVID. In Staffordshire, surge testing begins on Monday. The European Football Championships begins today in Rome, with gatherings across Europe, in England and Wales this weekend. If isolation stops COVID spreading, what happens when this tournament brings an entire continent together as a viral variant grows?
There are already serious doubts about whether England will come fully out of lockdown on June the 21st. Part of the government's strategy, announced in April, has been to use rapid COVID-19 tests to gauge the transmission of the virus. And at the heart of that calculation is the Innova lateral flow test being used in homes and institutions daily across the UK. But now the US Health Agency, the FDA, has published a damning review of the Innova test, suggesting its performance has not been established, that it only tends to pick up cases when there's a high level of the virus present, and that the best thing to do is to throw them in the bin. Well, the UK government agreed its first Innova contract before the evaluation of its tests had been completed, and it's due for review on June the 22nd. So if there are doubts about the quality of the test, might there be a danger the government has a false picture of how prevalent COVID is in the community right now. Here's our health correspondent, Deb Cohen.
These are the tests that have been a key part of our opening up. The rapid antigen tests, sometimes referred to as lateral flow tests, marketed by US company Innova. They're the cornerstone of Operation Moonshot, and we're using them in schools, in workplaces and mass testing centres to help break viral chains of transmission.
Lateral flow testing will be of great advantage to us all as we go forward. The NHS is now offering, as I say, these free tests, and I think people should use them.
But the US regulator, the Food and Drugs Administration, or FDA, has produced a scathing report about the tests, including how it performs, how it's manufactured and packaged. The US warnings are stark. The FDA has significant concerns that the performance of the test has not been adequately established, presenting a risk to health, telling the public to destroy the tests by placing them in the trash. The accuracy of the Innova tests has been fiercely debated in the UK too. The government says extensive clinical evaluation by PHE and Oxford University showed lateral flow tests are accurate and sensitive enough to be used in the community, including for asymptomatic people. But others are more critical about what studies have found.
All of these lateral flow tests fail to detect people who've got low levels of virus when they get a swab. In Liverpool, of those who had high levels of virus, as the authors of the report state, they actually missed a third of those cases, which is meaning that it could be a useful test to find cases if we're using it in mass screening. But if we're using it to make sure people don't have infection, so for example, for going to football matches, to nightclubs and so on like that, there's a risk that we'll be missing people who could be carrying the virus into those venues.
In America, the FDA has never authorised Innova's antigen tests for use, despite the company trying. The company says the US concerns are not relevant to the UK, and they have made over 1 billion tests for the market here. The UK government says the Innova test has already gone through our rigorous Porton-Down assessment process, and we have a robust quality assurance process in place.
It's important that the company shows us and proves to us, given that they've been found to be lacking in their processes in the US, we need to know that they're actually sound here as well. So I think the onus is on them and the Department of Health to prove to us that actually the quality processes they have can tell us that this isn't going to be a repeated problem in the UK. And for example, in the student testing in Scotland, the University of Dundee had a batch. They ended up with over 35 false positives in their student population because of a poor batch of tests.
As the Euros start tonight, those going to Wembley will be expected to be fully vaccinated or have a negative lateral flow test. Yet in December, the UK regulator, the MHRA, told the government that they should not be used to greenlight attendance at events. We do not currently support the use of the test for a test to enable function until we are satisfied there is evidence to support this. Studies have now been done to assess their use.
There were several events at the end of April, beginning of May, where they did use it as a green light thing for events. And we still have not seen the research from that. And rumours are swirling around, and they are only rumours, that one of the reasons for the delay is not because the research is not complete, but because we're awaiting ministerial sign-off.
Like so many areas of science in COVID, mass testing is hotly debated and often polarised. And as the UK awaits the results of studies looking at how well they work in different settings, this looks set to continue.
Deb Cohen. Well, let's discuss that with our guest. Professor Alison Pollock is Professor of Public Health at the University of Newcastle. She's also the Honorary President of the Socialist Health Association. And Professor Alan Wilson is the President of the Institute of Biomedical Sciences. Good evening to you both. First of all, Alan Wilson, with now what we know now from the FDA, should we just simply stop using these tests?
I don't think so. There's absolutely no doubt that the gold standard test is the PCR, but obviously that doesn't give you the immediate result that the lateral flow device does. I still think there's a role for a lateral flow device, And I think the difference between how we use it in this country as opposed to how it's used in the USA is that we use it frequently, regularly, and in that way we almost compensate a little bit for its lack of sensitivity. So as long as you've got correct protocols in place, I still think there's a role for lateral flow devices. It's always an argument about if we don't do it, we will potentially miss cases is doing this test better than doing no tests. And I think there's an argument to say that this test does offer something. It will pick up some asymptomatic cases, not them all, I accept, but enough that to make it still relevant, I think.
But if you say if the right protocols are in place, but if you're doing it in your kitchen table because you've got a batch of 10 for your employer and you want to go to a nightclub or you want to go to a football match, you know, you might do it casually, but it might actually lead to the spread of COVID.
I think that's the difficulty here. I'm not sure that it's appropriate to be using it for a one-off test for admission to something. I think that's the difficulty because that's not really what the test is designed for. I think it's much better as a mass screening almost exercise to do mass testing on asymptomatic people doing it regularly, and then when you will pick up a reasonable number of people of positive tests in an asymptomatic population. I think it would concerns for using it as a one-off test for entry to an event.
But what you're saying is that you've got a reasonable assumption of getting it right. We heard about the Dundee, you know, there were 35 false negatives. I mean, isn't that problematic? Because how can the public now have confidence, especially with this FDA report? You know, how can they have confidence in them? And secondly, how can they have confidence if the government's relying on them on a tool to let us move around more freely?
I think the Dundee study, any test can have done kind of a bad batch. PCR test can have a bad batch and you can get false positives. And I know that's happened across the country. So it's not unique to the lateral flow device. That's a one-off bad batch and it can happen to any test. I still think that there's a role for it as long as it's used appropriately. And I think the only other thing I would say is that there is now a fairly easy access to PCR. So where PCR can be used as an effective replacement for lateral flow device, given that we have good capacity for that and a good turnaround time at the moment, I think it's still worth exploring some aspects and some circumstances where we would use PCR instead of the lateral flow device.
I mean, well, the Department of Health saying that there's proper evaluation processes. You know, how often are these done? Are we going to hear more from Public Health England about that?
I'm sure we will, and my understanding is yes, all PCR tests, all lateral flow devices are regularly tested in Colindale and Portendown, and an issue there is to make sure that they are still testing positive for the variants of concern for the Delta and others. Other variants as they arise. So it's important as these new variants arise to make sure that the tests we're using to detect the virus are still relevant.
Alison Pollock, if I can turn to you on this. You heard Alan Wilson saying they're still a useful tool if they're used properly.
Well, the problem is we just don't know. We're a year into using lateral flow tests and there's been a complete lack of transparency with the government refusing to publish the evaluations. And you have to remember, 8 contracts have been awarded at a cost of over £2 billion. We've got 2 small studies, Liverpool, where they identified 70 cases, and the University of Birmingham, where they identified 8. That's for £2 billion. And the Department of Education is refusing FOI requests to publish the pilot studies on schools. So we really don't know. But what we do know is that there's no evidence that testing and test and trace has actually reduced transmission yet. I mean, it's quite shocking. The government's had every opportunity to conduct proper studies and proper evaluations, and it hasn't done so. And a big part of the problem is that these tests were developed for people with symptoms for clinical use. And what's happened is that Matt Hancock has put himself forward as the manufacturer. So we've got the Secretary of State now saying, I'm the manufacturer and I'm also the regulator, and I'm going to give myself the emergency use authorization for using these tests outside of the manufacturer's scope. We've got an extraordinary situation here.
I mean, it's fair to say, Alison, that you have really been a critic of the government right from the start of the way they've handled COVID. I mean, that is your political position. But do you actually think they do more? But you're also a practitioner, absolutely. Do you, hand on heart, think they do more harm than good? Seriously?
So seriously, we absolutely don't know. We spent £2 billion, at enormous costs. And what we know is that that is a huge opportunity cost. It's money wasted, and we haven't yet seen the evaluations. And all tests do harms. As the FDA has pointed out, they create false positives and false negatives. So of course they're doing harm if £2 billion could be spent on health, on social care, on education. That is extraordinarily harmful to society. And the other thing is we have no results on self-testing. But what we do know is that the number of people testing is going down because people have lost trust and confidence in the tests. So we're doing enormous harm and damage to testing and the clinical diagnosis as well.
Let me just put that final point back to Alan Wilson from you, Alan. That actually what Alison Pollock is saying is that people have lost trust in them. Do you get a sense of that, Alan Wilson?
I'm not sure I do. I think actually there's an accessibility to the lateral flow device that I think a lot of people find attractive. I would accept, I think, that every test is a false positive and a false negative. Every test does. And I think there is a risk from the lateral flow device that people who test negative think they're bulletproof and don the Superman vest and think that they can go out and do anything they want because they test negative and don't have COVID. And I think that's a strong message we need to get across to people. A negative lateral flow device doesn't really mean anything. You need to keep testing, keep doing it regularly. That's the value and that's the benefit, I think, from using lateral flow tests.
Well, thank you both very much indeed for joining us tonight.